Jentadueto XR is a medication used to help control high blood sugar in people with type 2 diabetes. It is meant to be used alongside a proper diet and exercise program. By controlling high blood sugar, this medication can help prevent kidney damage, blindness, nerve problems, loss of limbs, and sexual function problems. It may also lessen the risk of a heart attack or stroke. This product contains two medications, Linagliptin and Metformin. Linagliptin works by increasing levels of natural substances called incretins, which help to control blood sugar by increasing insulin release, especially after a meal, and decreasing the amount of sugar your liver makes. Metformin works by helping to restore your body's proper response to the insulin you naturally produce. It also decreases the amount of sugar that your liver makes and that your stomach/intestines absorb. It is important to take this medication as directed by your doctor. The dosage and timing will depend on your specific condition and medical history. Be sure to follow your doctor's instructions for the best results. Before you start taking Jentadueto XR, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth once daily with a meal, and be sure to swallow the tablets whole. Do not crush, chew, or dissolve the tablets, as it can increase the risk of side effects. Remember to drink plenty of fluids unless otherwise directed by your doctor. The dosage of Jentadueto XR is based on your medical condition, response to treatment, and other medications you may be taking. It's important to inform your doctor and pharmacist about all the products you use. Take this medication regularly at the same time each day to get the most benefit from it. If your condition does not improve or gets worse, be sure to inform your doctor. This includes if your blood sugar levels are too high or too low. Some common side effects of Jentadueto XR may include nausea, vomiting, stomach upset, runny/stuffy nose, or diarrhea. If these symptoms persist or worsen, it's important to inform your doctor or pharmacist. Additionally, if stomach symptoms reappear after taking the medication for several days or weeks, it could be a sign of lactic acidosis and you should contact your doctor immediately. You may also notice an empty tablet shell in your stool when taking Jentadueto XR. This is a harmless effect as your body has already absorbed the medication. It's important to remember that your doctor has prescribed this medication because the benefit to you is greater than the risk of potential side effects. While many people do not experience serious side effects, it's crucial to contact your doctor if you have any concerning symptoms such as joint pain, unusual skin blisters, or signs of heart failure. In rare cases, a serious allergic reaction may occur. If you experience symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. If you have any concerns about low blood sugar, it's important to speak with your doctor or pharmacist. Symptoms of low blood sugar include sweating, shaking, fast heartbeat, hunger, blurred vision, dizziness, or tingling hands/feet. There are ways to quickly raise your blood sugar if needed, and your doctor can provide guidance on how to manage this. As always, if you notice any other effects not listed here, it's important to discuss them with your healthcare provider. And remember, this is not a complete list of possible side effects. Please consult your healthcare provider for personalized advice, and do not hesitate to reach out if you have any concerns about your medication. If you take too much Jentadueto XR, it can lead to a serious condition called lactic acidosis, which can be fatal. This is more likely to happen if you are older, have kidney or liver disease, are dehydrated, have heart failure, drink a lot of alcohol, have had surgery, have had X-rays or scans with iodinated contrast, or are taking certain other medications. Your doctor may advise you to stop taking Jentadueto XR for a short time if you have certain medical conditions. If you experience symptoms of lactic acidosis such as extreme tiredness, dizziness, severe drowsiness, chills, cold or bluish skin, muscle pain, difficulty breathing, irregular heartbeat, or stomach pain with nausea, vomiting, or diarrhea, stop taking Jentadueto XR and seek medical help immediately. Before taking Jentadueto XR, it's important to let your doctor know if you have any allergies to Linagliptin or Metformin, or any other allergies. This medication may also contain inactive ingredients that could cause allergic reactions, so be sure to talk to your pharmacist for more details. It's also important to inform your doctor about your medical history, especially if you have kidney disease, breathing problems, liver disease, blood problems, pancreatitis, or gallstones. If you have surgery or any X-ray/scanning procedure using iodinated contrast coming up, make sure to let your doctor or dentist know about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. You may need to stop taking this medication for a short time before the surgery or procedure. You may experience blurred vision, dizziness, or drowsiness due to extremely low or high blood sugar levels, so be cautious when driving or operating machinery. It's also important to limit alcohol while taking this medication, as it can increase your risk of developing lactic acidosis, pancreatitis, and low blood sugar. Certain conditions like high fever, excessive sweating, diarrhea, or vomiting can increase your risk of lactic acidosis, so it's important to stop taking this medication and seek medical attention if you experience prolonged diarrhea or vomiting. Stress or certain medical conditions can make it harder to control your blood sugar, so consult your doctor if you experience such situations. It's also important to be aware that older adults may be more sensitive to the side effects of this drug. For women, it's important to consult your doctor or pharmacist about reliable birth control while using this medication, as metformin can cause changes in the menstrual cycle and increase the risk of becoming pregnant. During pregnancy, Jentadueto Xr should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. If you're breastfeeding, be sure to consult your doctor before continuing to breastfeed while taking this medication. It's important to be aware that Jentadueto Xr can interact with other medications, potentially affecting how it works and increasing the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. It's essential to consult with your healthcare provider before starting, stopping, or changing the dosage of any medications. If you are taking beta-blocker medications, such as metoprolol, propranolol, or glaucoma eye drops like timolol, they may prevent the fast or pounding heartbeat associated with low blood sugar. However, other symptoms of low blood sugar, like dizziness, hunger, or sweating, are not affected by these drugs. Additionally, many medications can impact your blood sugar levels, making it harder to control. Before making any changes to your medication regimen, discuss with your doctor or pharmacist how the medication may affect your blood sugar. It's important to monitor your blood sugar levels regularly and inform your doctor of any high or low blood sugar symptoms. Your doctor may need to adjust your anti-diabetic medication, exercise program, or diet. Furthermore, certain medications can affect the removal of linagliptin from your body, potentially impacting how linagliptin works. An example of such a medication is rifampin, among others. Always consult with your healthcare provider before taking any new medications to ensure the safe and effective use of Jentadueto Xr. If someone has taken too much Jentadueto Xr and has serious symptoms like passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Overdose can cause lactic acidosis, which may result in severe drowsiness, rapid breathing, and slow or irregular heartbeat. So, it's important to take the correct dosage and seek medical help if you suspect an overdose. Remember, always take medications as prescribed by your healthcare provider. Remember, do not share Jentadueto Xr with others. It's important to attend a diabetes education program to learn how to manage your diabetes with medications, diet, exercise, and regular medical exams. Make sure to learn the symptoms of high and low blood sugar and how to treat low blood sugar. It's also important to check your blood sugar levels regularly as directed. Before starting Jentadueto Xr and while you are taking it, you will need to have lab and/or medical tests such as kidney function, liver function, blood sugar, hemoglobin A1c, and complete blood counts. It's important to keep all medical and lab appointments. Be sure to consult your doctor for more details. If you happen to miss a dose of Jentadueto Xr, take it with food as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. Remember to store Jentadueto Xr at room temperature, away from light and moisture. Keep it out of the bathroom and away from children and pets. Also, do not flush this medication down the toilet or pour it into a drain unless instructed to do so. When it's expired or you no longer need it, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.